At Next 21, we solved the potential problems of conventional osteosynthetic titanium mesh plates and developed a mesh plate that is more compatible with the patient's bone. Therefore, we optimized the shape pattern and deformation pattern of topology, which is a new concept. Continuous infinite shapes for internal fixation plates include triangles, quadrilaterals, and hexagons. Internal fixation plates require the following. 1. Being able to process the 3D shape of the patient's bone surface. 2. To prevent breakage after implantation in the body, the elastic range is wide and stress is dispersed to prevent stress concentration. 3. With regard to fatigue fracture, it has a high buffering effect against external stress. We found that a hexagonal shape was the best solution to the above requirements, applied for a patent, and had it approved. Honeycomb structures, which are hexagonal infinite shapes, are common, but this is probably the first time you've seen this hexagonal mesh plate pattern. Trigon and quadrant infinite chain patterns create breaks and wrinkles when processing the mesh into a 3D shape. On the other hand, the hexagon pattern of Ultraflex mesh allows for three-dimensional expansion according to the desired bone surface shape. As shown in the photo on the upper right, by topological geometric deformation, it is possible to stretch the material to double its size without breaking. Looking at the stress-strain curve, the hexagon pattern, or Ultraflex mesh, has a wide elastic range. Since the mesh falls within this range after implantation, stress and fatigue fractures are less likely to occur. To process the 3D shape of this mesh, external force in the plastic region is used to reproduce the 3D shape of the patient's own cortical bone surface while limiting strain. This is the actual Ultraflex mesh pattern. A hole with a countersink is installed in every other pattern so that screws can be driven in any desired position. This is to smooth the screw head so that it does not protrude from the mesh plate surface. By using topological geometry and phased geometry, it is possible to convert a 2D planar mesh plate into a 3D solid mesh structure. A strange and interesting thing is that when a hexagon is expanded into 3 dimensions, a new hexagon appears. These are 2 mesh plates molded for the purpose of craniomaxillofacial bone reconstruction. These are 2 mesh plates molded for the purpose of craniomaxillofacial bone reconstruction. Mesh plate molded for the purpose of craniomaxillofacial bone reconstruction from different angles. In the field of orthopedics, it is used to repair fibular neck fractures that frequently occur due to sports injuries. Acetabular fractures occur when the head of the femur is forced into the pelvis. It is necessary to mold a 3-dimensional shape that can reproduce the complex shape of the acetabular bone. Calcaneal fractures in the heel occur when falling from a height during construction work or from a strong impact, such as in a traffic accident. The Ultraflex mesh plate can be fixed by wrapping around the comminuted fracture. Hand injuries often involve finger bones, especially scaphoid, hamate, and metacarpal fractures. Although the bone has a complex shape and is small, using the Ultraflex mesh plate allows 3-dimensional containment and fixation. Here, Ultraflex mesh plates are used for bone reconstruction after maxillary dissection. The mesh is made into a cage structure based on the 3-dimensional shape of the patient's jawbone, and PCBM taken from the patient's iliac bone is filled and implanted into the cage, and the bone regenerates for about 10 months. The implant is then placed into the regenerated jawbone and the artificial tooth is attached. You can regain the same appearance and lease functions as before. This is a reconstruction of the bone resection site from the alveolar bone side and the upper part of the jawbone. It is possible to perform bone regeneration using artificial bone using a thin mesh plate. If there is insufficient bone volume during dental implants, GBR bone regeneration of the alveolar bone is required. Ultraflex mesh plate is an excellent GBR titanium membrane. In addition, it has the flexibility to give a 3-dimensional shape, so it is possible to reconstruct bones in the ideal shape. This is a comparison of forged pure titanium. Specifically, a comparison between Ultraflex mesh plates, 3D forged pure titanium, and laser-sintered 3D printed titanium alloy mesh plates. Pure titanium does not cause allergic reactions. However, in the case of titanium alloys, care must be taken when transplanting them into hypersensitive patients or into bone close to the skin surface. Due to the advanced forging process, Ultraflex mesh plates have significantly higher tensile strength, yield strength, and elongation strength than SLS/3D printed titanium alloys. In general, SLS-sintered bodies become hard through thermal solidification, but because they are brittle, they are not used industrially as functional mechanical parts. Therefore, Ultraflex mesh has less risk of breakage after implantation into the body, and removal of the mesh plate after bone reconstruction is completed can be performed smoothly and safely. Thank you for your attention.